mother, as a woman, and as a doctor. I'm an obstetrician and gynecologist, and I have the honor to care for women on a day-to-day basis, to deliver their babies, to provide preventative health care such as pap smears and breast cancer screening, to prevent unintended pregnancy by providing contraception, and to provide abortion services to women who have decided that now is not the time for them to parent, or that have a pregnancy with medical complications. I'm here today to speak in opposition to the continuous assault on comprehensive reproductive health care by our state elected officials, and to demand that Ohio politicians get out of my exam room. These legislative attacks have directly impacted the families that I care for by forcing me to offer medically unnecessary services and information without any regard for the sensitive circumstances that surround each patient's unique experience. I can give one example by sharing the story of my patient Jennifer and her partner Sam. They had a very desired pregnancy and showed up at my hospital when Jennifer was nearly 23 weeks along. Unfortunately, Jennifer's water had broken early, which put her at risk for infection and gave the baby a very low chance of surviving without any major complications. Jennifer and Sam met with pediatricians, high-risk obstetricians, and family planning specialists like me, and ultimately made the very difficult decision to terminate the pregnancy. They didn't want to put Jennifer's health at risk. However, because Jennifer and Sam live in Ohio, I'm forced now to listen to the fetal heartbeat one last time and to offer them the ability to hear it. It doesn't matter that they may not want to. It doesn't matter that they've heard it a bunch of times before and that one last time may be incredibly painful to them. I'm forced to require them to do that and offer that to them. I'm also forced to tell them what the probability is of them carrying that pregnancy to term. These are statistics that are technically not available and a probability that is impossible to determine, but this is what the law makes me do. In addition, because of legislation that passed over a year ago, we had to perform viability testing. And based on the definition of viability determined at my institution, I couldn't care for Sam and Jennifer. Instead, I had to refer them to the closest state without a viability testing law. Therefore, during this very difficult and emotional time, my patients had to travel all the way to Pennsylvania for the abortion procedure, even though I have the medical expertise to care for them here in their hometown and state. Ohio's laws prevented me from caring for this couple. And when they asked me, why do I have to travel to Pennsylvania? Why can't you just take care of me? My only answer for them was the lawmakers in Columbus have decided that they know better. I'm tired of these never-ending assaults on reproductive health care,